Okay, so I have with me today Lucy from Afterbirth. She is a agency owner that uses BirthSync, and she uses the agency level service, and she has doulas that she brings on to serve the community of in Dallas. She was one of my first adopters. She was enthusiastic about, her. Once she saw the demo, she was like, yeah, okay, let's do this.
That's true.
She
That's
has, I consider her a power user. She has found so many ways that we can even improve the platform while she was using it. She brought up questions to me about certain workflows that may could be improved. I mean, I was able to get a lot done with her just using the platform and then with her doulas on the platform. So I really wanted to bring Lucy on and have her talk a little bit about, from her words, using the platform as an agency owner, somebody who manages teams and has staff, and how that's been. So, Lucy, I'm gonna let you go ahead and take it away. Introduce yourself.
of course. Well, welcome you guys. Like she said, I am Lucy Hicks. I am the founder of Afterbirth, which is a doula agency slash wellness collective based out of the DFW as well as 6 other states. So we use this platform, BirthSync, a lot. One of the things that is very, very helpful is that not a lot of doulas even actually document in the way that helps them continue to stay and or get competition ready. So we've navigated some very large contracts with healthcare systems, with cities, and things like that. And one of the things that they always want to know is what's the outcomes and how did you know and how did you track it and what output, what activity were you doing to even get this outcome and things like that. And so BirthSync has done a fabulous job with allowing us to track those outputs that created that outcome to see that end result metric that these organizations want to see. I love that now we can communicate with our doulas and our families just within the app. That was one of the newer features that I have been enjoying. Because, baby, texting all the doulas, all 22, listen, that's just out of my time scope, right? But being able to talk to them and see them interact with the families in the app have also been game changing. Another thing that I've really enjoyed is the labor snapshot from the lens of doulas. That was another game changing feature because we can really in real time historically capture what that family experienced as they were first admitted to them being discharged to home and everything in between. That has also been really, really, really helpful because a mom may be like, well, why did they ask me to do a C-section? Oh, baby, at 1302, your baby started to decel. And at
Mm-hmm.
1310, we had to flip you 4 times and baby still
Mm-hmm.
didn't get right. And we're able to catch those little things that are really beneficial to the families.
Yeah.
Especially because if mom is overstimulated, she's in and out, dad is trying to keep her comfortable. They're
Mm-hmm.
not paying attention to those little bitty things that's occurring that helps them know what happened from start to
Mhm.
finish.
And I was going to just
Um,
chime in and say the debriefing that happens after birth, the
yes,
labor snapshot is perfect for that. If
yes,
you're debriefing with your families, because our memory, it can only go so long. And a lot of times we misremember. We
all the
misremember
time.
times and dates
Rewrite it.
and who was in the
Yes,
room, who wasn't in the room, and what time did we do that? And what time
yep,
did we do that? I think it was.
yep.
And so the snapshot just boom,
Yep. It
time
catches
and
you in
date
real time.
stamped.
Not, and
Mm-hmm.
it's not a whole lot of things that you have to capture. It's just
Mm-hmm.
here, go to the bottom, put a note, done. And it
Yep.
shows you that timeline. So if you haven't utilized that, definitely utilize that. It's in visit notes at the very bottom. Okay.
Yes, right.
Okay. And then a final thing, while it's so many great things inside of BirthSync that's really well, one of another final thing that really, really was game changing is the notepad. So our doulas are told to soap note.
Mm-hmm.
Soap note is what clinicians, so hospital nurses, doctors, therapists, all of those, they soap note the experience from the family. And so our doulas, as well as on our team, we soap note from the lens of a doula.
Mm-hmm.
To be able to go into the notepad and talk to the system, tell it what occurred, and then the system not only generates the SOAP note the way my community utilizes it, but now we can also push save visit note, and it sends it. You just got to put your time in and stuff, and it sends it directly to that chart.
Yeah.
That was so game
So
changing.
time
Because
saving,
before it would generate it, but we still had to then go to the chart and copy. Well, now it's so much more seamless. And we have a policy, document within 24 hours. 24 hours is really actually a long time, because when you go to the doctor or the hospital or whatever the case may be, before you leave, you already have that visit note.
Yeah.
So that was very critical. And then I tell my doulas, after whatever that meeting is, whether it's a prenatal meeting, whether it's a postpartum meeting, or even if it's a bereavement meeting, right? Because some of our births just don't go as planned. You have the opportunity right then and there, while it's fresh on your mind, to talk to the system and let the system generate the note, and then go ahead and put it in a chart and be done. So I am so grateful to they even have come across the BirthSync platform before it was ever launched to the community, y'all.
Yeah.
Now, listen, before it came to the community, just so grateful and thankful that you as a labor and delivery nurse even thought about doulas and birth workers on this side of the spectrum. We definitely appreciate you for thinking about us from a non-clinicianal lens, to be able to help us document, capture outcomes, capture metrics, and even social determinants of health in specific zip codes, to know how we can continue to evolve and show up for our families. So I appreciate you so much.
Thank you.
BirthSync has definitely been a game changer for my organization. And listen, y'all, it's even helped me win a couple coins now. I'm trying to tell you, it's helped me win some coins, because I got the data to prove what I'm saying. Yeah. So if you are not utilizing it, you're losing. And if you are utilizing it, utilize it to its full capacity and potential, because it will help you stay competition ready.
Yeah. Awesome. Thank you. And this is a point of view I'm so glad you brought up, because a lot of agencies don't think about going after money in the community. There's money out there, y'all, for collectives, for organizations that are training up doulas, that are putting them and birth workers out to the community. That includes lactation, that includes, just all facets. There's money out
educators,
there, but they want to see your data. Yep. They want to know that they're investing in people who are documenting what's happening, who are following with the families, and in any time they can pop in and say, okay, what does the impact look like?
Yep.
You're able to provide that because the system was tracking it for you. You're able to provide how many of them have preeclampsia, how many of them are twins, how many, like, there's so many different things that are useful, and even for yourself and your business is very useful to the community, to know what you all are doing when you serve. And so I'm just glad Lucy was able to give that perspective, because I know that perspective is not common, and people think that they live in silos and that there's not money out there and they have to struggle to grow their agency. No, you don't. Not with the right tools.
Data is gold. If you can prove it,
really is. It's gold, and they can
they'll give you what you need to scale it. So thank you. I appreciate it.
Well, thank you so much for coming on and talking about BirthSync. I really do appreciate the time, taking the time. And we will definitely be in touch. Lucy's going to be one of our BirthSync billing trial accounts. So I'm really excited. That's going to be a game, like real. Like I put a lot of time into the billing because I knew that it was a huge pain point for a lot of the doulas to be able to have the proper notes, even lactation, to be able to have the proper note structure that was going to not get their claims kicked back.
That the insurance wants. That's the thing. It's not what how you document. It's what is the documentation needed for the insurance to say you can have this money.
Yep. And a lot of folks are frustrated with that process. And so that is what we're working on. And so definitely stay tuned for billing, because that's launching this summer as well. For our BirthSync users. So yay! Thank you, Lucy. Thank you.
Of course.
We'll talk soon.
All right. Thank you.